So happy to have you all tuned in today to listen to the broadcast. And as you well know, over the years of listening to the broadcast, I do try to squeeze in as much health related information as I possibly can on the broadcast because it is very, very important and vital for all of us. And I'm happy today to welcome to the broadcast Dr. John Lipman. He specializes in non-surgical treatment of uterine fibroids. And Dr. Lipman, how are you today?
I'm great. Thanks for having me on.
Of course. And this is a subject that many African American women discuss and have concerns over. You are founder and medical director of Atlanta's Fibroid Center. Tell us just a bit about the center, how long it's been around, and then we'll go into the discussion.
Yeah, well, I appreciate the time. As you said, I'm the founder and medical director of the Atlanta Fibroid Center. I've been treating fibroids completely without any surgery for the past 25 years, and I've been in practice in Atlanta for over 30. Our center is dedicated to the complete non-surgical treatment of uterine fibroids, and it's this procedure that I perform is called uterine fibroid embolization, UFE. It's one of the biggest medical breakthroughs for women, particularly African-American women, because they disproportionately suffer with these benign fibroids.
Can you tell our audience that don't know what fibroids are and also how it impacts a woman's body?
Excellent. Yes, absolutely. Fibroids are benign tumors, so they're not cancer, which is great, but they can cause a lot of misery in women. It's the most common reason why women have heavy periods, and it's the most common reason, unfortunately, that women undergo hysterectomy, and it's completely unnecessary. There are three big symptoms that fibroids cause. They cause a number of symptoms, but the three main ones are heavy bleeding, as I mentioned. It's the number one reason why women have heavy menstrual periods. It also causes a lot of pelvic and abdominal pain, and it also causes increased urinary frequency and waking up at night to urinate because these tumors are hard and firm. They're like rocks, and they press on whatever's next to them. So the ones that are near the lining cause the heavy flow. The ones that are in the front of the uterus press on the bladder to cause urinary frequency and waking up at night. The ones kind of laterally press on nerves to cause pain and bloating and pressure symptoms. So it can cause a lot of misery, and they disproportionately are found in African-American women. African-American women get them earlier in life than other racial groups. They get them more often than any other racial group. They tend to be bigger and more numerous, and often are offered only surgery, where we do this incredible UFE non-surgical procedure that treats all the fibroids all at once. It's a 30-minute or so procedure. They go home the same day, not only with their uterus, which is great, but they go home just with a Band-Aid at the top of the right leg where we go in.
Wow. Why is it that a black woman's body would inhabit these more than a Hispanic woman or a white woman or anybody else?
Well, there are a number of reasons. One, genetically, it runs stronger in families, but of African American descent. But unfortunately, nobody knows where fibroids come from, and that's another disparity that we need to talk about research. But nobody knows where these benign tumors come from. But once they arrive on the scene, they grow with estrogen. That's why they can grow rapidly during pregnancy, and why they tend not to be an issue for most women once they reach menopause. Now, estrogen is stored and produced in body fat, and in general, African-American women have more body fat on them than other racial groups. It also has to do with vitamin D. Vitamin D is the most powerful anti-fibroid growth hormone. It's actually a hormone, technically not a vitamin, but it retards fibroid growth significantly, but unfortunately, only 10% of African American men or women have adequate vitamin D. So that's an issue. So there are things we can control, like making sure the vitamin D is adequate, making sure patients lose excess body fat, exercise, make healthy eating choices. You can't avoid the hormones in the food and water, but there are certain hormone-rich foods which we try to at least curb, if not eliminate, which are red meat, non-organic chicken, and dairy, and increase the amount of colored fruits and vegetables that have flavonoids in them, which are compounds that block estrogen. So we have this anti-estrogenic approach through better eating choices, exercise, weight loss, normal vitamin D. And then if there are, if that's not going to be enough, and sometimes it's not, there are genetic causes for these fibroids that we can't control, then we can offer this great UFE procedure that gets the relief of symptoms without any surgery. You avoid the risks and long recovery of an operation, and you get to keep your uterus. And the recovery is a matter of 5 or 6 days versus 6 or 8 weeks or more with surgery.
And Dr. Lipman, you just used the word disparity, which, we in our community know good and well what that's all about and how many there are. Why do you think that this falls into that category? And is it because it hits black women more and the research has not been done?
Yeah, there are a number of reasons and multiple disparities when it comes to treating African-American women. I mean, I'm in Atlanta, and so the South particularly has a poor history when it comes to treating black women, whether it's Fannie Lou Hamer and the Mississippi appendectomies. And so there's I'm often asked, about the mistrust. And there was a study done at the Mayo Clinic up in Minnesota in 2013 from the Journal of Women's Health. And they looked at about 1,000 women that suffered with fibroids. And interestingly, and no comment was made about it, the vast majority of the women in that study were white women. Which, white women, why are we studying Caucasian women for a condition that 80% or more of African-American women have these fibroids? But, so that's one issue that we just, even when we do occasionally study fibroids, it's the wrong population that we're looking at. But anyway, the results of that study were interesting to them, not to me, really. They were the average time to treatment for these women suffering with fibroids was over 3.5 years, and over a quarter of them waited over 5 years. And they were totally perplexed by this. I wasn't. When they drilled down and asked why, they didn't want surgery, and they weren't given any non-surgical option like UFE. And so, there is a lot of mistrust based on the, poor history of treating women, because what happened at Tuskegee, that's obviously a seminal event that's kind of, in a sense, a microcosm of a kind of larger trauma, both historical and contemporary, which, continues to contribute to inequalities in healthcare.
Right.
I've spent my career trying to educate women that no matter what your gynecologist tells you, you do not need a hysterectomy if you're suffering with fibroids. They are benign tumors. And, just a few facts about hysterectomy. It's the second most common surgery done in the United States, which is staggering because half the population, including myself, don't have a uterus. And the most common reason why we do this very invasive procedure, surgery, is not for cancer, which would be appropriate. It's for benign fibroids, and the average age is less than 40. And I actually spoke at Tuskegee not long ago in front of a couple hundred young women about this, saying that this is the Tuskegee experiment of our lifetime because women are not being informed about UFE. Essentially, I have the penicillin to their syphilis. And so, we need more awareness about this procedure, UFE. It's one of the biggest medical breakthroughs because the alternative hysterectomy is affecting not only black women, but young black women. After Tuskegee, after I spoke there, 3 women under 30 came up to me in tears because they had already had a hysterectomy in their 20s. This is tragic and totally unnecessary. Why are we essentially amputating young black women for benign disease. It's got to stop.
Yes, it does. And there is not enough discussion on this topic at all. And I think a lot of women, because of what they're going through with the painful menstrual cycles and the heavy flow, they may not want to talk about this or may not want to say anything and keep it to themselves. Is that part of the problem?
It is absolutely part of the problem. There is a lot of stigma with periods, heavy flow. Women don't want to talk about heavy periods, and fibroids are the number one reason why they have these heavy periods. So they often keep it to themselves. They don't discuss it. They're embarrassed. We've got to end kind of not only period shame, but period poverty. We contribute to organizations in Africa and other areas that don't even have basic sanitary products. I mean, it's just horrible. But we do need to increase the conversations about women's periods. In fact, we love it when men show up to our talks because while men know nothing really about women's periods, they need to know because they often have women in their lives.
Right.
This is important information not only for women, but also the men, so they can empathize and understand what these women are going through. It is significant what a lot of women kind of push through, and some women may not even realize what a heavy period is because they've been doing it for so long.
Right.
That's an education in and of itself.
And is this also accompanied by just severe cramps and pain and almost debilitating to that degree? Yes,
that is one of the big three symptoms. So not only heavy, horrific bleeding symptoms, the bleeding can be just these big, large clots the size of your fist, blood running down their legs despite wearing multiple pads at a time, sometimes period panties or even, depends, diapers. And the pain that's associated with it is very significant. And so these women often suffer unnecessarily. They don't want surgery, and that's the only option they've been given. And I understand why you don't want surgery, but they're entitled to know about this UFE procedure. As I say, it's outpatient, it's covered by insurance, it's a 30-minute or so procedure. They have a recovery for a few hours. They go home with their uterus and a brief recovery at home of a matter of 3, 4, 5, 6 days, and get to keep all their parts, and they get their life back. It's transformational when a woman, everything revolves around her period, everything she does or does not do, whether it's work, whether it's relations, whether it's going to the pool, whether it's, wherever she's got to know where every bathroom is, she's got to have extra clothes with her. Everything she does revolves around this horrific menstrual, and then she has the UFE procedure, and she gets her life back and doesn't have to worry about that. She not only gets her life back, but she gets all of her energy back. It's transformational, but unfortunately, most women suffering never hear about it.
And that's really sad. Now, let me ask you this, because I know Atlanta has Morehouse, and Meharry Medical College is right across the street.
Yes.
I don't recall hearing much. Is it because the HBCU educational institutions that teach this, there's so much that they have to cover? Is this a subject that's not covered?
I don't know if it's covered in HBCUs. I have spoken at Spelman and at Morehouse, and we see a number of Morehouse School of Medicine residents and house staff come to our center, watch us do the UFE procedure, given grand rounds at Morehouse and at Grady. And so, there is education out there, but it's not just the HBCUs. It's, all medical centers. In fact, I am headed to the University of Arkansas to give grand rounds to the OBGYNs in Little Rock here shortly. But it's something that everyone needs to know about because it's been around. I've been doing this for 25 years. This isn't anything new or experimental in any way. It is well-proven, safe, and effective. As I mentioned, it's covered by all insurances. So this should be a no-brainer.
Well, the reason why I'm targeting HBCUs is because, there's one across the street, it's a medical university. They're teaching the doctors. I don't recall hearing that conversation.
If you want to have Meharry come and
okay, well, they're across the street. They're probably listening, Dr. Lipman.
Yeah. So, from your mouth to God's ear.
Okay.
Don't give me an excuse not to.
Well, I think a lot of women in this region would be, interested in this information. And is there an age range when women need to really have a major concern? And can you also talk to parents that have daughters that might be experiencing this, and their daughters don't, because of shame or stigma or whatever, haven't said anything?
Yeah, I think that's part of this solution is increasing the conversations between mothers and daughters, between friends at church groups. A lot of churches that we speak at have health ministries. A lot of information is gleaned in the churches, as you know, and that's an important avenue to get important information out to the community. So we spend a lot of time talking to women's groups in Black churches. But yes, we need to increase the conversation. And the other piece of this is we need to increase the research. As I mentioned earlier, nobody knows where fibroids come from. And it's just horrible that relatively little money has been given to fibroid research based on how much of a problem this is to society. To give you an idea of the disparity there, if you look at the amount of money that fibroids get in research each year, it's roughly about $18 million, which might sound like a lot, but it actually ranks in the bottom 50 of the 300 most common medical conditions. And remember, this is something that affects at least 80% of African American women, and it also affects, a significant portion of women of other races. And it's hard to estimate, but roughly this costs about $35 billion a year. Fibroids impact society at about $35 billion a year. So if you take, 18 million in research and you get 35 billion people, roughly about 26 million women in the United States affected, that comes out to about 69 cents per person affected. And you compare that to, say, a condition that affects Caucasian individuals, which is cystic fibrosis. So cystic fibrosis gets about $94 million a year in research and affects only 30,000 people. And so that translates to $3,000 per person affected. So you've got a condition that affects primarily Caucasian individuals getting $3,000 a person, and you get a very common condition that affects Black women and other races, but disproportionately African American women getting 69 cents a person.
Oh, wow.
It's totally unacceptable. And there is legislation that is just sitting in the House and Senate, unfortunately not moving. It's called the Stephanie Tubbs Jones Uterine Fibroid Research and Education Act. And hopefully it will, somehow get bipartisan support. I mean, unfortunately, it's just kind of sitting there, but it gives $30 million a year for the next 5 years to the NIH to study fibroid research and try to figure out where fibroids come from. It also directs the CDC to give important educational materials to educate not only the public but also physicians about these non-surgical treatment options like UFE.
Right, and how you said you've been in this, Dr. Lipman, for 25 years?
Yes, and yet, again, most women, and we've had numerous studies to prove this, most women that go to their gynecologist never hear about UFE. They only hear about hysterectomy or myomectomy, which is surgically cutting out some of the fibroids. And, just surgery is just not necessary for fibroids. We don't need to do hysterectomy. UFE, as I say, it has a 90% success rate in a procedure that patients go home the same day with a Band-Aid.
Wow.
And it treats all of the fibroids. They get the relief of symptoms, they avoid surgery, and they get to keep their uterus. Because another thing that's not talked about very often is what happens to women, particularly young women, say average age of hysterectomy under 40, what happens to these women when they lose their uterus? It can affect them in numerous ways.
Right.
It can affect them psychologically. It can affect them sexually. It can affect urinary leaking, bone loss. And if you don't believe me, check out wherever you shop for groceries or pharmacies and see who's on the package of adult diapers. I mean, adult diapers, to me, I think the person should be grandma or grandpa,
Right.
an elderly man or woman. You won't see that. You'll see a young woman of color. Why? Because these are very sharp marketing people. Madison Avenue, Depends is from some big company, either Colgate or Kimberly-Clark, one of them. And they have very, sharp Madison Avenue marketers. They know who their target is. It's not grandma. It's not grandpa. It's young African-American women who have had hysterectomy for fibroids. Now they have to wear a diaper because they can't control their urine. You take this big fibroid-filled uterus out of the pelvis, and now these young women have to wear a diaper. I mean, I have a Depends ad in my office. It's a young, attractive, thin African-American woman, maybe 35 to 40, and she's slipping on her skinny jeans over an adult diaper, and it says something cute like, "They'll never know your secret."
Wow.
What? I mean, I want to know why this woman needs a diaper. Like, what the hell? I mean, it's crazy, and it's got to stop. I mean, UFE is one of the biggest medical breakthroughs for women, particularly women of color, and yet they don't mention it. I don't know how they sleep at night.
I don't know how they, and we are, and hopefully our audience is, after this interview, becomes much more informed. And of course, if they're having this issue, ask your physician. Now, when you go to a gynecologist and they don't know about this or don't mention it, is it time for a second opinion?
Absolutely. If your gynecologist with a straight face can say they don't know about UFE, that's on the BS scale.
Okay.
I mean, they should not. There shouldn't be a gynecologist. Now, that being said, they most likely won't mention it, but sometimes the patient knows about it from education, through maybe a family member or the internet or what have you. Or this interview from Fisk, maybe they know about UFE and they ask their gynecologist about it, but then they'll get the top 10 urban myths about UFE. Oh, you wouldn't be a candidate, which is false. Almost every single patient that is a candidate for surgery is a candidate for UFE. They'll say, oh, you have too many fibroids, or your fibroids are too big. That's false. Never too big, never too many. It treats them all. You won't be able to have children after. That's false. In fact, our births are typically full-term and vaginal. We've had multiple twin births. If you have myomectomy for fibroids, you're going to get a C-section. They won't let you have a vaginal birth ever, ever, ever. So vaginal births go out the window if you have uterine surgery, where, as I say, our births are typically full-term and vaginal. You still have that option. So there are a lot of myths that the gynecologists perpetuate about UFE because they want to operate, and it's really sad. I mean, they went into gynecology, I presume, to help women. Why else would you become a gynecologist?
Right.
I have one of the biggest helps for women of all time, and yet you don't mention it, or if you do, it's despairingly because you want to operate. It's just sad.
Let me remind the audience, this is Dr. John Lipman. He specializes in the non-surgical treatment of uterine fibroids, and he's talking about the procedure that so many women need to know more about. He is founder and medical director of a fibroid center in Atlanta, and I'm very, very happy to have him on the broadcast today. And Dr. Lipman, of the 26 plus million women that are diagnosed with these fibroids, what percentage of that is the African American woman?
A significant portion of them are African American, and we have a lot of women we call the silent sufferers. There's over 1 million of them, and most of them are African American. They're on the sidelines. They're just suffering with the symptoms of fibroids, the heavy bleeding, the pain, and what have you, because they're suffering because they're only given surgery, and they don't want surgery. I don't blame them. I wouldn't want surgery either. So they're just told to suffer with it until they're ready to do their hysterectomy. And that's a shame. I mean, we could help so many more women if these silent sufferers were informed about UFE, because, as they say, UFE is highly successful. It's covered by all insurances. It is well proven safe and effective. You avoid surgery completely. No hospital, no surgery, no long recovery, no surgical complications. Keep all your parts, get the relief you're looking for, home the same day with a Band-Aid.
Wow.
It is miraculous, but you got to know about it,
Yes,
unfortunately.
absolutely. The more you know, the better off you're going to be. Now, Dr. Lipman, since at the very beginning you said what the uterine fibroids are, and since they're non-cancerous, in the early days of when you first got into this, were they sometimes mistaken for cancerous, and the other women had the same kind of symptoms, and the heavy flow, and the pain and all? Were those two confused at times?
Typically not, because cancer, fortunately, is very, very unlikely in women that are in their 30s and 40s. And that's a, peak incidence for women with fibroids. And we have outstanding imaging. We use what's called MRI, magnetic resonance imaging, which is way better than pelvic ultrasound, which a lot of women have had at their gynecologist's office. The MRI sees things to much greater detail. Now, the UFE procedure actually got discovered by accident, as a number of things in medicine are. Back in the early 1990s, early to mid-90s, we had been embolizing cancerous tumors for quite some time, but a group in France decided to embolize these benign fibroids pre-hysterectomy, because embolization cuts the blood supply off to all the fibroids and renders it an easier operation. So in the early 90s, this group in France embolized these patients. The interventional radiologist in France did the procedure, but in France, the medical system is socialized. It's socialized medicine. And so you have to wait for your elective hysterectomy. So they did the embolization, and they sent the patients home, and they waited 6 weeks, 7 weeks, 8 weeks for their elective hysterectomy. Well, what happened over that 6, 7, 8 weeks? Their symptoms went away. And these women would call the gynecologist and say, I'm supposed to have this hysterectomy next week, but my symptoms are gone. Do I still need this surgery? And when they looked at it, the answer was no, you don't need to have the hysterectomy. All you need was the first part, the embolization. And so the gynecologist in France who was overseeing this study called his best friend, who was the chief of OBGYN at UCLA, and said, this is really interesting. You need to look at this. And so Scott Goodwin, who was the interventional radiology chief at UCLA at the time in the mid-90s, did the first 11 patients, and he was presenting his first 11 patients in the United States with UFE, and I was presenting embolization on cancerous tumors of the liver. And I was at this talk, and I'm like, wow, I'm in Atlanta. This sounds fabulous. I got to check this out. And that became my life's work. I've been doing it. They say I did one of the first in the Southeast, if not the first. And I have done roughly 10,000 UFE procedures in the past 25 years. And we have the largest worldwide experience In fact, pre-COVID, we had seen patients from every continent except Antarctica.
Wow. Wow.
So it's a tremendous procedure, but unfortunately, even after 25 years of doing it, you kind of need to know about
Yeah,
it.
true. That's true. That is true. It would seem like the insurance companies would save money by having this.
Well, you would think so, and the procedure, anytime you do a procedure, it's certainly less expensive when it's done outside the hospital as it is in our center. But a number of places do this in the hospital. It's still outpatient, so it is less expensive, but it's not dramatically so. Plus, all of the, all of the things that are done in women's health, the insurance guidelines, they all rely on the gynecologist to set those parameters. And so, they don't want any more UFEs than are already being done. And so the guidelines to do UFE, are stricter than the ones for surgery. There's the fast lane if you want to get hysterectomy, but, you've got to go through all sorts of, insurance hoops to get UFE. But, it is covered by all insurances. You just have to do, more legwork to get them approved. And then, frankly, there are, as you know, a number of women that don't have any insurance, and it doesn't matter what procedure you're getting, whether it's hysterectomy or UFE, it's out of the affordability range, and that's another issue that, is difficult.
Absolutely. And it messes with a lot of people getting their health straight. And Dr. Lipman, does it like run in the families? Is it something like that? Is it every other generation? Yes.
If your mother suffered with fibroids, you are very likely, particularly if you're African American, you're very likely to also suffer with fibroids. And that's why, when people ask what's the best people to talk to, the peak is in the 30s and 40s, but I like speaking to college-age women or postgraduate women, because you have a chance to kind of change the trajectory. If you can, battle fibroids before they're a problem, if you can do the preventive maintenance, it's just like a car. I mean, I'm a mechanic, and I fix a lot of cars that are broken, but if you can do the right maintenance, eat healthy, avoid the hormone-rich foods, keep as much excess body fat off of you, every woman knows what their ideal weight is. If you can be as close to that number as best you can, if you can keep a normal vitamin D, maybe you don't have to see the mechanic for a broken car. Maybe you can you can avoid this UFE as well as surgery. It would be great not to have to do anything. That would be the least invasive, easiest thing.
Right. Well, I think, hopefully folks that are learning something about this today, that know someone in the family or your own daughter or whatever, will tell somebody. That's what I hope. And Dr. Lipman, can you please tell the audience how to find out about your work and the center, and then to do more research on this topic?
Well, fortunately, it's easy to find me. We have a website, which is atlii.com, atlii.com. It stands for Atlanta Interventional Institute. It's the parent company of Atlanta Fibroid Center. We also have a YouTube page, which people like, because they can actually watch me do an entire UFE procedure. It's a little over 30 minutes. So if you're on YouTube and you go to Atlanta Fibroid Center, you can subscribe. It's free, and you can see there are hundreds of videos on fibroids, on UFE. That people can watch. And then we have Instagram. Some people like Instagram. That page is very visual. We have a lot of infographics and testimonials. In fact, the recent thing we have on there is a talk I did with Damon John from Shark Tank. And he's been very helpful and interested in this issue, because he not only has a young daughter, but he has a lot of women in his family that are interested in this. So that page is Dr. my last name, Dr. Lipman.
Excellent.
Lipman.
Okay.
Dr.Lipman.
Though there's plenty of information and resources for you. And Dr. Lipman, we just talked right before the interview, and you have a son in Nashville, right?
I do. So I don't need any excuse. If Harry wants me to talk, I'm there.
And, we're across the street, so if that does materialize.
I'm happy to come to Fisk, too.
Yes, most definitely.
If
Yeah.
live performance at Fisk, I'd be happy to do that.
Okay, thank you so much. Because when you told me that at the beginning before we started doing this interview, I was like, there's always a family connection to Nashville. And I noticed this in a lot of the people I interview. Somebody has a son, a daughter, a cousin, an aunt, or, something here. So, it's pretty ironic for us to be right across the street from the place, and they do listen over here to WFSK. Dr. Lipman, thank you so much for your work and for your research, and I greatly appreciate what you're doing.
Well, I really appreciate your time, and thanks for having me. And it's we need more help and more information and more people talking about
Absolutely.
this. It's important information.
Yeah, well, I will, keep your information here, your number and on contact, and possibly circle back around with you, okay?
That would be great. I would love that.
All right. Dr. Lipman, have a glorious rest of the day.
You too. Thanks very much.
That is such interesting and needed work that he is doing. And thank you for your time, Dr. Lipman. And hopefully some of the ladies out there heard something that can be of a help or service to them.